I'm Jo Cowcher, Director of Adult Social Care. I've been a social worker now for just over 23 years, always worked in Staffordshire, so very passionate about delivering services in this area. Still a registered social worker today, so remain very passionate too about social care and getting it right for individuals. In the new organisation, I will be Director of Adult Social Care, so I will have a role on the board, but also responsibility for the two Section 75s that we've got with the County Council, but also the other services that we've got that provide social care services, and that's across the board, so more specialist services. When I refer to social care services, I'm referring to a whole plethora of services, including reablement, which is now more normally known as Home First, occupational therapy services, and the more traditional social work services that will deliver the statutory services under various acts, such as the Care Act or the Mental Health Act. Three priorities for me are very much focused on the individuals out there and how we can make a difference to those people, because I think that's what motivates us all to come to work, and we need to see some real improvements in the services we deliver. So first of all, it would be very much around a dementia pathway. I'd like to see an integrated dementia pathway. A lot of the focus is around admission avoidance and pulling people out of hospital as quickly as possible. And that's something that none of us are very good with people with dementia at the moment. There's too many people going into hospital, too many people going into residential and nursing homes. And actually, if we work together, we can keep people at home in an environment that's familiar to them, with people around them that they know and can support them. So that would be the first thing I'd really like to see happening. I think the second thing is around IT. If we can have a joint IT system that we can all access, and we've got access to those records and that information, not only will that benefit us as a service because it will make us more efficient, we'll be more informed, it will also mean that the level of care and the quality of care that we can deliver to individuals will be much improved, because we'll actually be at the stage where we're not going out and asking those questions 20 times, because we'll have that information there, we'll know what's going on, and the care will be coordinated in a much more effective way. And I think from a social care perspective, for that to happen, we need to put a lot of work into the workforce. We need to really get a workforce strategy that makes sense for social care and sits within that integrated organisation, but actually to look at career opportunities for individuals, the training that we've got for people to make social care the best in the country rather than somewhere around the bottom. I think for me, what I'm most excited about is absolutely getting this right for people. If we can make a difference to people's lives, then that has to be the absolute thing that we aim for. I really believe this is the right thing to do, and I genuinely think that if we work together better, but we also work differently, so it's not just about coming together, it is about making some really significant changes in the way that we deliver care, that we can support people in really innovative ways but have a real impact on them. So we should see things like more people living in the community, less people reliant on care, less people in residential and nursing care, and also people spending months and months in hospital where they just don't need to be. So for me, it is around absolutely providing the right level of care to individuals within their own home or the environment that they choose if their home isn't the right environment, and absolutely making a difference that's tangible.